Medical Dystopia. Alright, y'all, this is Isaac for SE Wolverines. How's everybody doing out there tonight? Gotta talk about the medical medications, first aid a little bit, just because it's part of being prepared. I would call myself trying to be prepared. I'm not all the way prepared. It's an ongoing evolution. Y'all like talk about evolution so much. And you can never think you're too good, bro. You can never think you got everything. It's how you play yourself, man. It's how you play yourself. We got to talk about this subject. A lot of times when we go into this realm, it's very wishy-washy as far as will you get a strike or not. Some of the rules, I don't understand. Different people do different things. Different people say different things, and some people can say it and some people don't. So I don't know. I'm not doing anything on purpose for y'all that don't know. If you're new to the channel or if you're just been a subscriber for a minute and you don't know, actually in my professional life, I am a nurse. I am a nurse. I've been a nurse for a while. I don't want to age myself. I don't want to age myself. But I've been a nurse for a little while, y'all. Just a little while. I know all about it. So part of being prepared, you have to be prepared health-wise. If you ain't clicking, you're going to end up kicking. You feel me? So got to make sure your health's straight. If your health ain't straight, you're going to depreciate real fast, y'all. And you can be in trouble, folks. I'm going to try to the best of my ability to touch some subjects. I'm not a master. I am not a doctor with and we'll just get it out now. You'll probably hear this a lot. I'm not a doctor. Please consult a doctor, a professional care doctor for information. I'm just trying to give you some subjects maybe you want to think about and ask your doctor. If you have any questions, feel free to reach out to me on anything. That's why I have a channel. You want to write me a comment? You can type mad fast. So I reach out to a lot of people. I try to reach back for the most part. I miss some things, but nobody's perfect. So we're just going to try to touch on some generic subjects. So the first thing I really want to say is diet and exercise. Everybody knows this. It never changes. If you have a good diet, eating good foods, and if you exercise regularly, it's only going to help you, y'all. During the pandemic, a lot of people sat around. A lot of people put on that extra tie around that belly button. So you want to try to work that off while you have a chance, while you have access to and consultants like physicians, like endocrine doctors, dermatologists. You have access to these people right now. Work on yourself. And while they are available to you right now, you should really consult them. So I'm not just saying that as just a piece. Use the knowledge. There's some very smart people out there, y'all. And while you have a chance to see a doctor, because if it all goes sideways, you might not be able to see a doctor. Who knows what's going to happen? Nobody knows. But while you have access to a doctor right now, you should do some homework in the area that you have a concern with. Maybe you'll get something out of this. Maybe this is something. Hopefully somebody gets something out of something. You feel me? So while you have access to your doctor, any type of medical professional right now, you should consult your doctor about things and worries. And now you might go in there. I'm a little weird with it too. And you don't want to talk to your doctor about, what if the apocalypse happened? They might look at you and send you to a psychiatrist. You feel me? So, if you have a personal relationship, or I'll try to give you the best way to go about doing things so you don't really have to say all that if you're not comfortable with saying that to your doctor. If you're not comfortable saying something like that to your doctor and you feel like he can't help you in any way, when he's there for you, you might want to find another doctor. So I'm saying, if you can't even talk to your doctor about anything such as that because he's brushing you off and that's really concerned, well, I guess he's not really looking out for your concerns, y'all. But that's up to you to determine. I have no idea. Consult your doctor. There's natural remedies. Get yourself a book that talks about them for yourself so you can educate yourself so you can go to your doctor. Do your own research. get natural remedy books, other medical books. Go over the information, write down what you're concerned with or more information you want to have, and go to your doctor. Now, a lot of people, you go in the doctor and you wait forever in the waiting room. You wait forever and you get in there and they kind of just brush you off and push you out real quick. But hey, man, if you're paying that doctor money, you better use every minute that you can. That's all I'm saying. You better use every minute that you can, as long as possible. And consult your doctor, y'all. They ain't freaking gods or something. They're no better than you, y'all. You'll just leave it at that. They're no better than you, y'all. They work like you work. So don't think they walk on water. I know some of them might think they do, but that's another topic for another time. So holistic care, stuff like that, go to your main doctor, talk about it if he ain't trying to hear you. If that type of service is at your service in your area, go talk to a doctor like that. There's medications for pain. There's medications for drug withdrawal of different natural remedies. So do your homework, find out about them, and go talk to your doctor, y'all. Consult your doctor. I'm going to keep saying it. And how do you like your doctor in the background, by the way? Let's change that chump out, and we'll get you another doctor. If that doctor ain't working, we'll get you another doctor, y'all. Go to another doctor if he ain't working for you. So, okay. There are survival handbooks. They're written by doctors, real medical doctors. One is called the Survival Doctor's Complete Handbook by the name of James Hubbard. If you're into something like that, so you can read the book and then consult your doctor with the information that you learn. There's also, this is why you want to get a detachable hard drive, y'all. Get it by yourself. You should do it if you got the money. If not, save up. Buy yourself a detachable hard drive so you can download information while you can right now on the internet. It ain't going to be there, man. There's free PDF files. One is called Where There Is No Doctor, and the other one is called Where There Is No Dentist. Free online. Download those to detachable hard drives. That's the type of stuff you want to download to. They're free. You can use different type of supplements for different type of things. You know, I know a lot of people's insurance might not pay for them, but some might. Learn what type of supplements might have to go with the thing that you're conflicted with, and then consult your doctor. Okay, now another thing you can do if you're on type of some medications and you're worried about the supply of what you have available is a lot of doctors, if you go and ask them for a script for 3 months instead of 1 month, I'd rather get caught on that day if the thermonuclear weapons fail y'all. Hopefully it's that day when you got that 3-month supply. Hopefully it's that day when you have a 2-month supply. Could have a 1-month supply or be almost done with your 1-month supply with no supply coming back at you. You feel me? So a lot of doctors will write your prescriptions for 3 months and some medications. You got to talk to them instead of 1 month. Now, your insurance might not cover the whole 3 months. They might only pay for 1 month at a time. Some things you might have to pay those ducats out the pocket, y'all. Some medications are, of course, less, and some of them are mad expensive, man. So expensive ones probably can't do it with. Some of your lesser known generic low costing drugs is something that you might pay $5 more than your insurance is paying out. You feel me? So it's worth it, man. To me it is. So consult your doctor, see if he can write you a 3-month prescription instead of 1 month. There's also different types of drugs that need refrigeration. Look to, if you don't have access to electricity, look to there's something they call, like back in the day, they used to use root cellars because you dig in the ground and it's cooler in the ground. So there's also something called root refrigerators. So look into root cellar refrigeration. You might not have electricity. We're gonna touch electricity, so stick around if you're into type of preparedness. Kind of on a low level, because I'm broke. I'm sure y'all's is broke. So, but if you don't have enough power to have your own fridge and a freezer at home, they make coolers with refrigeration, a freezer on the side, and they make these things. They could power them with 12-volt battery. You can power them with solar pattern. You don't have a lot of room, but if your medication's got to be stored in there and you need them refrigerated, it's something you just might want to look out for, y'all. Make sure your temperature's all right on this stuff. Just look into root cellars, and there are professional root refrigerators, if I'm not mistaken. I'm pretty sure there is. I got to look into this more. I got my thing, you know what I'm saying? But as far as this type of thing, look into that. For refrigerated medications, make sure your temperatures are right. You might want to invest in some thermometers. There's also online care MDs. There's Jace Medical. I'm not a consultant, but there are several different online pharmacies and online doctor consultants available all across the board. So just make sure you're going to the right guy. Jace Medical, I heard, was pretty good in this subject matter of crossing your T's and dotting your I's. You feel me? So look at it in the different online. They might could write you a prescription for a certain amount of months. A lot of them, this is what they're there for. So they're cool with it. Especially like Jace Medical. And like I said, I'm not a representative, never even using them. I'm going to start using them. I'm going to tell you that much. But starting and using them is two different things. You better get on it, y'all. You better get on it. So I don't get paid by Jace Medical. I'm not affiliated with Jace Medical. Now, if Jace Medical wants to do something with your boy here, nod, nod, wink, wink, holla, but I don't work for free, Jace Medical. You get one for free. They got things like antibiotics, and they cater to this area of expertise, preparedness, and they can help you out with your medication supplies. Just leave it at that. Look for info. There's certain kind of blood thinners. A lot of people are on blood thinners for various reasons. And you have your more expensive blood thinner medications like Xarelto. You know, maybe it's not that bad with your insurance. And then you have cheaper versions of blood thinners like Coumadin. You might could switch from Xarelto to Coumadin. Consult your doctor. Just don't switch. Consult your doctor. But just ask him if you can switch. Just because the Xarelto is very expensive. If you can afford it, just get the Xarelto with the 1 to 3 month, however your funds allow you to do it. But for some people, there's lower costing blood thinners out there than that. So you can just make yourself available and better for you to obtain if you're struggling with money. Also, on any of these companies, most likely you can write them and they might help you out with a price or something as well. Never seems to work. At least for me, at least. But we'll see what happens in the future. Good luck to you if you decide to do that, my friend. So, differences, some of these blood thinners, you're going to have to check your PTINR. There's machines out there. There is, unfortunately, a lot of machines. You got to have strips for them to read what your blood is. So, kind of do your homework in that. There are machines you can buy. A lot of people, not everybody, might not be used. So, make sure you go see your doctor. Once they're on a certain medication like that, it tends to level out after a little while, and you're good with your levels. They don't be bouncing up and down. Instead of checking every month, you could check every 3 months. If every 2 months, you could probably stretch it out a little bit more, providing that you had that medication to take, but you could just stretch it out a little bit more as far as testing goes. Because the strips aren't going to be readily available to you, but you can stock up on it. People sell them online. They're expensive. Maybe that's something you got in your back pocket and just keep doing your thing, whatever you're doing right now. You feel me on that? Do your thing, cop that in case you need it for later, alligator, and you'll have a smile like a crocodile. Talk about some vision. A lot of people, you can get extra scripts for your glasses. I suggest you obtain extra glasses. I get contacts if you can afford it. Get everything, man. Get everything. Solution. Get all of it. Somebody might be 35, 32. Somebody might not have vision problems right now that listen to this. But you best believe, Father Time, because it's up to your hind part, son. Your eyes might be a little fuzzy. Might be a little fuzzy for you. So it'd be good if you take your tail down to that $1.25 store and get as many reading glasses that you can obtain, from the smallest strength to the highest strength. Even if you don't need glasses or never will, it's good to be prepared to use those glasses as a bartering item. And I'll just touch on a couple just different things real quick. Video's getting a little long. And the saber tooth, get a drug handbook. Get a drug handbook. Preferably the newer, the better. So get a drug handbook so you will be able to identify the numbers that are written on so many pills today, y'all. In the future, you never know where you're going to come across. If you can't identify that medication, what are you going to do with it? So get a drug handbook. You probably get them at flea markets. You can probably get them at used bookstores. People sell them all the time. You see them all the time. Get your chubby little 5 fingers and get yourself a drug handbook. Okay? There are people online that are in the medical field. Some are doctors, some are nurses, some are different things. And they're into this type of thing. Preparedness. They offer classes on it. They will consult with you on it. I know just off the top of my head, I haven't done it for myself, but you could go check it out. I know the Patriot Nurse offers some sort of course like that. There's other people that offer the courses. I don't offer a course, although maybe in the future, who knows what the good Lord upstairs will bring. So there are people that offer classes in preparedness and readiness and getting your hind parts out of Dodge, that you could take a class. I don't know. You'll have to check any type of fees. I have no idea. I don't consult for the Patriot Nurse. I just know that's one of several many. All right. Now, just to touch on first aid real quick, make sure you get antibacterial soap. Talk about hygiene. You gotta wash your tail, y'all. Wash that stinking tail. Get a whole bunch of antibacterial soap. Keep your hands clean. If you have a wound, keep the wound clean. Wash it. Get the debris out. It's gonna hurt. All that dead tissue out. And it's gonna hurt. Take some of Grandpa's old cloth scissor and bite down on a stick, because it's gonna hurt. All that debris and dead skin, and make it look healthy and red, and it's gonna hurt. But you gotta clean it with antibacterial soap, and you gotta make sure you have gloves on. Get some gloves, medical gloves. You can get all these at medical supply near you. And also sterile bandages. Get some sterile bandages. Keep a clean environment around you as best as you can, my man or woman, or the other, my brother. Keep a good, clean environment. Make sure you get your ibuprofens for anti-inflammatory. Make sure you get your ibuprofens, and make sure you get your Tylenols. And of course, we're just touching on little subjects. We'll get more in depth when we need to in different subjects. Just simple. You always got that one. Slow down, medic. We'll get to it. Slow down, medic, but ask me some questions if you need be. Just slow down, medic, and we'll get to areas when we need to be. But don't let that stop you from, if you have ideas, please feel free to leave them in the comment section below, yo. So we're just gonna leave everything at that right there for you, son. And make sure, say it with me, folks, consult your doctor and hit that like button for brother. It's Isaac, S.E. Wolverines, and I'm out. Just slow down, medic. We'll get to it. Just slow down, medic. We'll just leave it at that. Thank you, and have a fantastic day. Good night, America. S.E. Wolverines!